This is comparison between advantage and disadvantage of Thailand and Japan healthcare system. Firstly, I will talk about the advantage of Thailand healthcare system. Advantage of Thailand component with treatment cost and the standard of hospital. Moreover, government and EEC support Thailand into the world medical hub. Thailand, in addition to having a good service, medical expense in Thailand, both private and public hospitals, is also cheaper than in many countries. For example, half the procedure cost if you go operate in Singapore, the cost is $18,500, but if you come to Thailand for treatment, the cost is only $11,000, which is almost double price. Next, the standard of hospital. In Thailand, we have 42 hospitals that are Joint Commission International. We are the first in the world, compared with the other countries in Asia. It can be seen that Thailand has the highest standard of hospital. Lastly, government and EEC. EEC is Eastern Economic Corridor Development Project. The goal is to reach business in Thailand into the global economic zone. Next important thing is that EEC is helping to expand Thailand into the being comprehensive medical hub consists of three parts as follows. Firstly, modern service. Prevention. The prevention of medical service where the internet and smartphone to provide advice and service to remote patients both at home and abroad. Manufacturer of medical devices of remote diagnosis and monitoring. It is rooted in the development of modern sensors and measuring equipment which can meet the needs of key consumer groups as the research based on emphasis on process reduction and shortening of modern data in accordance with the new technological advancements.
Even Thailand has several good healthcare services, but there still have several problems waiting to develop in the future. The first problem is human resource. Since the shortage of doctors in Thailand leads to reduce the number of doctors per patient. One doctor could have busy schedules and commute can result in little quality times to consult with the patient. Also, the less flexible schedule made the doctor couldn't get full time to relax, so it could have some mistake happened. Not only a doctor, but it also has limited nursing staff. Several patients need a nurse to look after them all the time, but it seems to be impossible. You should get a loan from the private hospital with an expensive cost to receive good qualities. One of the problems is called brain drain or inadequate medical. It's about precision working harder without enough incentive together with increasing demand and more financial incentives in the private sectors. It have resulted in the outflow of human resources, particularly physicians, from the rural public facilities. The number of doctors, more than half, is only in Bangkok, so the others area couldn't get enough treatment from the hospital. Moreover, the expenditure is seen to be inefficient. It have dramatically increased, and more than 3/4 of the cost is only the cost for medical care, and it didn't make for the prevention and the health promotion. However, there are many organizations to look after the overall features of healthcare system, which is called the lack of coordination, planning, and it's very hard to fix the problems. And there are the distributions of the medical facilities and expensive medical equipment are different in each area.
Next, let's study about advantages of Japanese healthcare system. In Japan has some similarity and difference compared to Thai system. For Japanese healthcare, it is called National Health Insurance or NHI. People tend to get healthcare benefit from the government by paying from some part of their income. The proportion is depend on ages and salaries. First level, less than 6 years old has to pay at 70% of co-payments. Next is 6 to 70 years pay at 30%. Additionally, 70 to 74 years pay at 20% or for current workforce can pay at 30%. For the last level is more than 74 years old pay at 10% or at current workforce can pay at 30% too. This money will go back to be their benefits, as they can go to hospital anytime with any disease that naturally happens. For people who are NHI members, they just show their NHI card, so they have to pay only amount of specification as their personally borne expense selling, no need to pay for treatment. Moreover, paid back cash is used in this insurance. NHI members can get money back in the case of payment is paid in full amount of medical service. Furthermore, for higher medical service expense, they will get the subsidy. If the treatment expense for them is over the certain amount, they will get the money back in after 4 months.
There are several advantages or problems of the healthcare system in Japan. First of all, the balance of medical payment is collapsing. As one of advantages, patients can have high-quality medical treatment with low co-payment in Japan. That's because the medical expenses could be covered by the health insurance premium, which working generation pay. However, Japan is facing a declining birth rate and an aging population. It can lead an increase in the medical expenses and a decrease in the health insurance premium. Therefore, the health insurance premium cannot cover the medical expenses. Moreover, nowadays the number of unnecessary uses of an ambulance is increasing. In almost countries, people need to pay to call and use an ambulance. On the other hand, in Japan, all people can call and use an ambulance for free in the case of emergency. However, some people call an ambulance even though it's not urgent. For example, someone calls an ambulance because of a slight injury, sunburn, or a mosquito bite. Another person does that because he doesn't want to wait for his turn at a hospital. If people have to pay to use an ambulance, the cases don't happen. The Japanese government should reconsider the proportion of co-payment or the uses of an ambulance for free to solve the issue of the public healthcare system.